Good evening, according to my local time in India. I am since I'm traveling from Indian connection on the lower side, and also some regions I could not prepare the PowerPoint. Nevertheless, I would like to make a brief point. How much time I'm getting? 15 minutes or 20 minutes? I think I would like to prepare, arrange my presentation, thinking that I am getting a 15 to 20 minute time. So the title of my presentation is Social Determinants of Pediatric Management. So in my presentation, as it sounds, I'll be talking about not medical aspects, non-medical or social aspects of pediatric management. So when I use the word non or social aspects, I mean the social determinants of poverty, like inequality of income, poverty, and sexual discrimination on the basis of male or female of a child. So these are important considerations. And before I go ahead, I'm sorry, very quickly I like to tell you things about myself. My name is Dr. Santosh Kumar Mishra. I'm not a medical person. I've done a PhD. And I work with the SNBP Women's University, which is Women's University within Damodar Thakursi Women's University, which is located in Mumbai city of India. And I joined the university in 1986 and I retired in June 2020. And in terms of my academic and research background, I did my PhD and also I studied certificate course in hospital healthcare management. And I have special interest in women's issues, including the health of women and girls. And I am more interested in doing more research on the issues connected with sexual and reproductive health of women and girls in these parts of the world. And I did master's in economics and then I studied demography and PhD. And I have some several publications to my credit, like I have authored books, journals, books chapters, and journal articles published in national international journals. And also I've contributed to more than 100 e-discussions. And also I've served as an organizing committee member for more than around 100 international conferences, and I have contributed more on e-discussions which are organized by FAO, which stands for Food and Agriculture Organization of the United Nations, which has its headquarters in Rome, in Italy, in Europe. So I've done a lot of work with the World Health Organization, Food and Agriculture Organization of the United Nations, including the United Nations, and various collaborations in various capacities, including as a collaborator and as a researcher and as a contributor of the discussion for various organizations. So in my work, I'll be talking more about social determinants of pediatric health. And as I said in the beginning, when I use the word pediatric health, it refers to the health of both male and boy girls in the context of their socioeconomic and demographic background. And again, I said in the beginning, I apologize that some pre-travel elements that were prepared the PowerPoint of my presentation as required. So I will be talking in my presentation about social determinants. And in terms of objectives of my work speaks about social determinants of pediatric health in children. And I have used secondary data in my presentation, and method of the data analysis of my presentation is descriptive. I have not used any statistical or techniques for the purpose of analysis data in my work. So, in terms of the major focal point of my work, I say that it's very essential to preserve the pediatric health, the health of women and children. We should be sure that they do not get infected with any, they are not confronted with major health issues, and also they are from any likely future health complications. So in this context, it becomes very difficult, very important for the healthcare provider to ensure that we look at their health profile in terms of their socio-economic background, in terms of what is the background of the children, what is the education level, and what is the education level of the parents, including their socio-economic and demographic profile, so that accordingly, healthcare providers design and implement a very healthcare program that really ensures that that's very meaningful for the children of all parts of the world, not only from Singapore, where conference taking place, including in India, including countries in Asia, Europe, in Latin countries, or in Caribbean countries. So all children on the earth, we must ensure that they are in good, both physical as well as mental health, as emphasized by the World Health Organization, as well as other international organizations, including the UNICEF, United Nations Children Fund. So when we look at the health profile from the demographic and socio-economic profile point of view, then we have to realize what exactly is the requirement, what type of healthcare exactly they need in the context of the background they belong. So that becomes very important. And sometimes the healthcare providers are not very sensitive enough to the individual health requirements of children, especially both boys and girls, are more about girl children, because still in certain countries, in some society, some girls are discriminated against, and they are not given the same healthcare facility which is on the par with which is provided to the boys. So it is very important to see that there is no discrimination and there is enough fund allocation, because especially in settings like rural areas where children, girls and boys, girls and boys, they do not have enough transportation facility. They do not have access to the healthcare provision. So it becomes very difficult for them to get the type of healthcare that they need. So healthcare providers must be very sensitive to the need of the healthcare of in the context of the socio-economic development provided by children. So that's a very important aspect of my presentation of my analysis of data in this abstract which I have submitted to this conference organizers. So that's one point I'm making. Another point I want to say that I would like to say that we must be see that children get the need-based healthcare, not the type of healthcare. In my capacity as healthcare provider, what I think is best for them. So what exactly is required? So maybe we need to go to the field and we need to prepare the health profile so that we need exactly what type of healthcare services they need. I hope my case is audible and this is good. So this becomes very important in especially, and this becomes more important especially in Asian countries in India, which have a large population base with inadequate health infrastructure. For example, countries in Asia like Mumbai, New Delhi, Kolkata, and Chennai in India, and Shanghai in China, and Manila in the Philippines. So these are the countries in Asia which have a large population base. So with the large population base and in view of inadequate healthcare infrastructure, because the government does not have enough resources to provide the type of healthcare services people, children need, including the parents need, it becomes very difficult. So it is very important for us to see that we are sensitized enough about the health requirements of both boys and girls in the context of their social and socio-economic or cultural belief. And also it is very important to see that they have this. And we also need to have a system where there is a follow-up mechanism or evaluation so that we know exactly where we have gone wrong, how the program has been implemented, planned and implemented, and to what extent we have received the success, and which are the areas where we need to focus in terms of improvements in program strategy or at what is wrong. So we need to have a very holistic approach about the entire healthcare system in the context of social determinants of the pediatric health. And in this context, the role of all stakeholders, including health providers, including nurses, including the school education system. I think the school education is one platform or one institution through which a lot of what I should say health education can be imparted to children, both boys and girls in all countries located in Asia, America, or Latin countries or in Europe. So the role of the teacher as a health provider, I think that becomes very important. And plus the healthcare providers, including doctors, nurses, and all the healthcare workers working in hospitals, both in urban and rural areas, including semi or rural areas. Especially the situations where the healthcare infrastructure is not enough. So we need to be sensitized enough so that we know what type of healthcare service, healthcare service exactly is required. And we design and implement an appropriate healthcare program which meets really the needs of the children. And we also make sure that we have a inbuilt, what I should say, more monitoring and evaluation mechanism to which we exactly know how much success has been made and which are areas where more improvements are required, which are information areas. That's sounds better. Intervention areas. So these are the brief points I would like to make. And at this time of my presentation, I would also like to say that a lot of health education, health literacy programs through the health literacy program, a lot of information we can reach out to the children, including their parents. But those programs should contain the information in the language which children and their parents they understand. It should not be the print and to be not published in a language which they do not understand. So healthcare providers must be sensitive enough to the exact the healthcare needs. And that reminds me that around 13 years back, I was in some place near Vasu in USA, and there was a special international conference of health literacy. And I was invited as a speaker in that health literacy forum. So there also had a lot of deliberation and consultation with the various stakeholders. And we agreed that yes, we should be sensitized enough and we should not go with the idea that we know all the health requirements of the people. Sometimes we are not aware of the health requirement. We must have a maybe socioeconomic survey or health literacy assessment tool with us through which we know the health requirements. And also we need to have a research tool with the help of which we know the progress made and with the help of which we also know which are the implementation areas. So with this brief presentation, these key points, I would like to end my presentation, and I would welcome any question coming from any aspect of my presentation. So thank you, Susan, and thank you the conference organizers for providing me the opportunity to present my research work. And again, my apologies, we accepted for not doing the PowerPoint presentation due to some personal reasons, some health emergency situations that we have been. So with this, I end my presentation, and I would welcome to answer any of the questions coming from me. Thank you so much, Susan.